All right, take a breath or two off of it.
Shirley Sellers has a passion for scuba diving.
I loved it so much, I decided to become an instructor and pretty much made it my world.
But a year and a half ago, the expert instructor and dive shop owner found herself out of the water and sitting poolside.
I would have periods where my heart would race, and then sometimes it would feel like it would actually stop. And I would wake up sometimes in the night when it would be racing and just have terrible panic attacks and anxiety.
Shirley was misdiagnosed as having a panic disorder, but soon found a cardiologist who recognized her symptoms as something more. Dr. John Bashai, an Emory cardiologist specializing in electrophysiology, determined through high-tech testing that Shirley had a condition called atrial fibrillation.
Atrial fibrillation is a very common arrhythmia, or a heart rhythm disturbance. Essentially, it involves the upper chambers of the heart, the atria, and there is disorganized electrical activity which creates sort of a quivering of these upper chambers.
Medications can help, but they don't work for everyone, and side effects can be troublesome. Now there's an alternative, a procedure called radiofrequency ablation that offers a cure for many people. Using catheters threaded through the groin and up into the heart, doctors burn or ablate the specific areas causing irregular heart rhythm.
The goals of the ablation procedure is to identify these areas of abnormal electrical activity that are triggering the atrial fibrillation. Once they're identified, we can then apply radiofrequency energy and burn those areas, and thereby blocking those electrical activity signals from coming into the atrium.
Shirley had the ablation procedure at Emory, which has the only comprehensive atrial fibrillation program in Georgia and one of the few in the Southeast. Just one day after the procedure, her symptoms disappeared. Now Shirley's energy and enthusiasm have returned, so have her underwater adventures.
There really are no limitations now on what I can and can't do physically, and mentally it makes a big difference for me.
For Emory, this is Rhonda Rowland.